So kia ora koutou, ko Justin Butcher tōku ingoa, and I'm the CEO here at Pinnacle Midlands Health. We're delighted to introduce the Tikanga in Practice guidelines to assist our network in providing more culturally appropriate care for their patients. From a Pinnacle perspective, it's an incredibly important piece of mahi for us, strategically around how we honour te tiriti and also how we assist our practices to tackle some of the persistent health inequities that Māori continue to face even in 2026. So for the just over 100,000 whānau Māori that are enrolled with our Pinnacle network, we do know a couple of things. Firstly, we know that Māori are overrepresented in the use of things like the emergency departments and urgent care facilities, and still a little bit underrepresented in the use of general practice. We know there's a number of reasons that contribute to that: cost, access, all barriers at times. But what we didn't want to be a barrier was the culturally appropriate services. So the aim of the Tikanga in Practice guideline is to assist our practices to build their competencies and their comfort levels in addressing how they provide these services for Māori. We don't want these guidelines to be seen as something that our practices need to look at because they're not delivering good services. We know that our practices deliver amazing services, not only to whānau Māori, but to other high needs populations. But we can always strive to do a little bit better, and that's where the essence of these guidelines are coming from, is how do we continually look at how we improve some of the services so that we can make the most of every interaction that we have with the health system.
Kia ora koutou. Ka moe a koutou ko ai tēnei noho ana, i mui a koutou, ko Rawiri tōku ingoa. So what we do know in regards to the Tikanga in Practice resource, it helps build the relationships with our Māori communities. It also provides knowledge and education for our clinicians when they are engaging with our whānau. Our hope in regards to the utilisation of the resource is to help practices build manaakitanga, which is caring for their patients, as well as whanaungatanga, which is about building relationships both with our communities and our Māori patients. So we do hope that this resource helps you and supports you in providing culturally competent care. Kia ora.
Ko mā whānau tokamanga, ko Mersey tokawa no Ohope, toku kaingarua, ko Joe Scott Jones toku ingoa. So I'm originally from the UK, I was brought up in Merseyside, but I've lived in Ohope for the last 30 years. I've been really privileged to be the clinical director for Pinnacle for the last 8 years. The Tikanga Best Practice guideline, I think, is such a huge addition to the resources that we offer, the support that we offer to practices. Personally, I've always found that doing simple things like sharing my pepeha, as I've just done, has really increased the connection that I've been able to make with patients. And our job is so much about connection. Most of us will be familiar, those of us sort of trained in Western medicine, will be familiar with the Roger Neighbour framework for consultations, where we make connections with people, we summarise what we've said, we then examine them, and then in that process, after that, hand over responsibility back to our patients. We do some safety netting to make sure that they understand what we've said, and then we do our own housekeeping, sort of finalise our notes, make sure we've done the referral, etc. And there's many parallels in the Tikanga Best Practice guideline that help to elevate that into an Aotearoa sensitive model of consultation, which I think will improve our connection and improve our ability to guide patients, help them to do the right thing for their final outcomes of health. I'm really excited to see what eventuates as this gets embedded into our day-to-day practice.